misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi everyone. Pregnenolone is a hormone that is produced in the brain as well as, of course, an adrenal gland. It's an adrenal gland type of hormone. And it does regulate mood, it does help you, and there are studies that suggest that will have potential benefit in improving your memory, cognitive function of all types, and of course, reducing anxiety. It is a precursor. It's a wear and tear hormone. If you're looking at youth, it is the grandmother youth hormone right after cholesterol. For numerous steroids, it is the beginning: cortisol, progesterone, dihydroepiandrosterone, and allopregnanolone. And these all come from cholesterol through pregnenolone. And there's research that indicates that pregnenolone may act as a neurosteroid, which means it can influence the neurotransmitters in the brain, that activity, as well as enhancing GABA, gamma-aminobutyric acid receptors. It's associated with, as I said, reduced anxiety and relaxation. It can interact with NMDA pathway, so it can also help with folks that are having some memory disturbance because of that. And furthermore, pregnenolone is a precursor to the other hormones that do impact cognitive function as well. So by supporting pregnenolone, you may indirectly be improving this person's mood and thought and their cognition. Of course, there's not a lot of material that goes forth, but for me, it's an important hormone to replenish as I replenish DHEA as readily. Now, pregnenolone levels will decline more than 60% as we age. And we start off usually with its high being around 220, 230. It will also directly affect other substances as MT-associated protein, MAPS, which these defects have been related to major depressive disorders. And so if you can help MAC levels, you're potentially helping to relieve or alleviate depressive type symptoms. So there were some studies. There was a small study in 2017, only 11 patients with bipolar, but it did show that pregnenolone did have a very positive effect on this, and they did have decreases in the MAP levels, so it was helpful in this small group. Now, of course, no large study has been done on pregnenolone yet, but again, it's an important component for me as a clinician, and I'm Dr. Mitch Ghen. Thank you for watching this, but be aware, pregnenolone supplementation can help everything, including even schizophrenia. There was also a small study in 2019 that would help. In 2018, there was a similar study that was also able to show reduction in schizophrenic symptomatology, especially when it was the first time that person was having that symptom and they were not on antipsychotic drugs at that particular time. So how do you prescribe it? Well, it's prescribed typically anywhere from 25 to 100 milligrams. There are some clinicians that have used even up to 700 milligrams a day, and I would do that with caution, of course. But the way to start this and realizing that it is the grandmother hormone is to do what I do. Test it in all your patients once a year. A simple blood test is going to tell you whether the pregnenolone is on a high end, a low end, and certainly whether or not repletion would make sense. And then follow it. You could start at whatever level of repletion that works for you, and then look at it and follow it up in another month or two to see if you've made a difference. And watch the patient and see how they do as well. I hope this was helpful. Yes, pregnenolone, it's an important component of our hormone balancing. Plus, it's an important component of what we call youth, where wear and tear is much less than repair and restoration. Thank you so much for watching. Dr. Mitch Ghen.